and reached out to millions of audiences online through our extensive promotion on social media and digital space. IHW Council, always welcoming the like-minded companies, social organizations, in uplifting people, communities and societies. Let's join the movement for people to get their basic birthright: clean air, clean water, good food and good health, and help in making Bharat a
Well, ladies and gentlemen, it is an honor for me to announce that we have amongst us Shri Ramdas Athavaleji, Honorable Minister of Social Justice and Empowerment of India, and Shri Shrikant Bharatiyaji, Member of Maharashtra Legislative Council. I would like to take this opportunity to request Mr. Kamal Naran, CEO, IHW Council, to welcome our esteemed dignitaries. Let's have a huge round of applause, please. Well, a very, very good morning, ladies and gentlemen, and a warm welcome to the 8th edition of India Health and Wellness Summit and Awards 2022. Namaste, my name is Melanie Pace, and it gives me immense pleasure to welcome you all here at India's most prestigious flagship Health and Wellness Summit and Awards, co-hosted by the Department of Health and Family Welfare, Government of Maharashtra, and supported by Niti Aayog, Government of India. We would like to thank our Pharma partner, Walter Kluwer as a silver partner, Zoho Healthcare, Salucro, and Emils as an associate partner, Teamwork Communications Group as communication partner, Healthfluencer as digital partner, Tarpan as NGO partner, IHW TV as digital media partner, and DreamWorth Innovations as support. Health and Wellbeing Council institution for holistic health awareness, advocacy, and behavior change, inspired by the UN's holistic approach to sustainable development goals. The IHW Council works towards creating awareness and advocacy for a healthier, happier world with the core belief that health is everyone's responsibility. The high five of health: good air, good water, good food, good lifestyle, and good health care for all form the pillars of IHW Council's foundation, and it works towards improving access, availability, and affordability of all these critical elements of life through another 3 A's of awareness, advocacy, and action. The IHW Council aims to create awareness through the significance of holistic health and well-being, fighting non-communicable diseases, climate change and social determinant of health, women and child health, and policy discourse and public awareness, thus encouraging conscious efforts towards achieving a better and improved world for our future generations. India's largest health and healthcare knowledge sharing and network forum feels proud today to welcome all our chief guests, dignitaries, and prominent speakers to address some of the critical issues and opportunity to fix the fundamental of lifestyle for environment, which is also the core of the G20 presidency in India. With the support of the healthcare and medical fraternity, the Council is determined to create a larger impact in line with G20 in H20 initiative, which is to present the global health leadership for good health and healthcare for all. Well, ladies and gentlemen, we shall begin with a lighting of the lamp. I would request our dignitaries to please do the honors. Shri Ramdas Athawaleji, Honorable Minister of Social Justice and Empowerment of India. Shri Shrikant Bharatiyaji, Member of Maharashtra Legislative Council. Mr. Kamal Narayan, CEO, IHW Council, and Ms. Nikki Gupta, CEO, Teamwork Communications Group. Of the Integrated Health and Wellbeing Council, Mr. Kamal Narayan, to please come on stage and talk about health for all, health for everyone. Let's welcome him once again with a huge round of applause, please.
Honorable Union Minister of State for Social Justice, Government of India, Sri Ramdas Athawale Sahib, Honorable Member of Maharashtra Legislative Council, Sri Shrikant Bharati Sir, eminent doctors, healthcare professionals, members of industry, and ladies and gentlemen, Namaskar. It is an honor for me to welcome you all for the 8th IHW Summit 2023. We at IHW Council have been relentlessly working on creating awareness around critical issues of health and well-being for all. The guiding philosophy of the Council is that health should be the priority for all and is a fundamental right for realizing for all human needs. We also believe that good health and environment is not the sole responsibility of governments or policymakers, but all individuals and entities to play a role to achieve this. The year 2023 is a watershed moment for India, with the world already talking about the Indian crisis management post-COVID-19. We once again ourselves find at the helm of global stage with the G20 presidency. There is a sense of optimism, excitement, hope among all of us. Along with the government, every citizen is confident that the year will witness great strides and growth in all social and economic determinants of human life. India's timing to chair the G20 cannot be more perfect after the gloom of the pandemic The time is right for the world to come out of the ravages of COVID-19 and build back better. And this has been the mantra of the Prime Minister Sri Narendra Modi also, that how we can bring together the world energies to build back better. The world needs sustainable, resilient, robust solutions to the crisis being faced by humanity today. From climate crisis to averting geopolitical tensions, India has the potential to address global issues and find long-term impactful solutions for them. The G20 stage is an apt opportunity to not only showcase India's health innovations and schemes at the international level, but also providing a roadmap for many nations to follow. Traditional wellness practices derived from the ancient Indian culture and ethos can provide holistic health solutions to the world. The balance between our environment and our well-being is one of the most important issues being faced by humanity today. In the post-pandemic era, climate crisis and global warming has got everyone talking about it, and world is at the tipping point where we cannot waste any more time in mitigating the concerns on which the very existence of human being is dependent. It is a great coincidence that while we have gathered today here for this summit in Mumbai, the city is hosting the visionary Prime Minister of India who has been the catalyst for transforming the health scenario of this country. Apart from critical missions like Ayushman Bharat, Poshan Abhiyan, Anemia Mukt Bharat, he has also given the mantra of lifestyle for environment to make climate action a people-driven movement. The IHW for the welfare of health of the planet and its habitats. This IHW Summit, which is a flagship program launched by the Council in 2014 with the core vision to accelerate in create awareness on significance of sound health, environment and well-being. We are happy and privileged that today we have got participation support from the entire industry. All of you have gathered today for this momentous occasion, and we look forward to have a very inspiring, engaging over the course of day to day, and look forward to a roadmap which sets India on the trajectory of global leadership in the space of health and well-being during this year of G20. All of you for your support and confidence on us. Thank you.
Well, thank you so much, sir, for a wonderful start. And now, ladies and gentlemen, to begin the day and to set the tone of the day-long knowledge forum, it is an absolute honor to invite on stage our esteemed dignitaries. Let's welcome with a huge, huge round of applause, Sri Ramdas Athavleji, Honorable Minister of Social Justice and Empowerment. Once again, ladies and gentlemen, let's have a thunderous round of applause.
My dear friends and sisters, today IHW organized this very important seminar because in our life health is also very important. Health is wealth. the health is not good. Good. And therefore, in our life, wife is very important. But we want to support for the health education. Health education is also very important. Doctors are also taking very broad responsibility. They are also supporting all the people whose health is not good. Doctors are also supporting all of them. Or Kamal Narayan, he is also my good friend. I attended many programs in Delhi. But first time today I am attending this program in Mumbai. And today is the very best day for Mumbaikar. Because our Honorable Prime Minister Narendra and this program is also organized here in Mumbai. Our Prashant Bharati is also the member of Legislative Council. He is also present here. Many dignitaries also present here. And we are also thinking about our health. You know that when the corona came in India, not only India, all over the world, corona was very dangerous disease. Corona came here first in China. At that time, I organized one rally at Gateway of India near Taj Mahal Hotel with China's ambassador. And that time I have given the slogan, "Go Corona, go, Corona, go, Corona, go." But now there is no Corona in India now, because all the doctors help many people. The life is also very important, and many institutions, many NGOs supported the people, given the medicine, mask, sanitizer, vaccine. Our Prime Minister Narendra Modi announced that the vaccine should be free for all. And many diseases are also always coming everywhere. Cleanliness is also very important. स्वच्छ भारत को बनाने के लिए हमें काम करना होगा. भारत को अगर स्वच्छ बनाना है तो अपना घर स्वच्छ बनाना चाहिए. अगर अपना घर स्वच्छ बनाना है तो अपने मन को स्वच्छ बनाना चाहिए. अपना मन अगर स्वच्छ रहेगा, अगर अपना ठीक रहेगा तन, अगर अपना ठीक रहेगा तन तो आनंदी रहेगा मन. अगर अपना ठीक रहेगा तन तो आनंद, जिनके कारण आज का ये आ गया है क्षण, जिनके कारण आज का ये आ गया है क्षण, उनका नाम है कमल नारायण. तो कमल नारायण जी ने ये प्रोग्राम आज का ऑर्गेनाइज किया है और बहुत सारे महाराष्ट्र से और भी कई राज्यों से यहाँ डेलीगेट आए हैं. पर्यावरण भी बहुत बड़ा इंपॉर्टेंट होता है। पेड़ लगाना चाहिए, पेड़ तोड़ना नहीं चाहिए। पर्यावरण को ठीक करने के लिए अपनी हवा अगर ठीक रखनी है तो पर्यावरण की आवश्यकता है, पेड़ की आवश्यकता है। और पेड़ अगर बहुत सारे रहेंगे, जंगल भी रहना चाहिए, घर के पास पेड़ होना चाहिए। तो पेड़ अगर होगा तो हवा, तो उसकी भी जिम्मेदारी हम सब लोगों ने उठानी चाहिए। पर्यावरण अगर ठीक रहेगा तो हम ठीक रहेंगे, हम ठीक रहेंगे तो पर्यावरण को हम ठीक करेंगे। और माननीय नरेंद्र मोदी जी का एक बहुत ही बड़ा सपना है, आत्मनिर्भर भारत का तो सपना है ही है। लेकिन जब वो प्रधानमंत्री बने तब उन्होंने स्वच्छ भारत अभियान अनाउंस किया। स्वच्छ होना चाहिए, रास्ते में कचरा नहीं होना चाहिए, हम लोगों ने रास्ते में कचरा नहीं डालना चाहिए, और रोड भी स्वच्छ होना चाहिए। कर रहा है। अभी मैं अमेरिका में था, लास्ट मंथ 1.5 months बिफोर आई वॉज देयर इन अमेरिका, नियर अबाउट 7-8 days। तो अमेरिका के कंपैरिजन में इंडिया में बहुत बड़ी ह्यूमैनिटी है। वहां अगर होटल में जाते हैं तो अपनी बैग लेकर हमको जाना पड़ता है, लेकिन इंडिया में होटल में यहाँ लोग अपने को मदद करने के लिए आते हैं। जो भी कोई गेस्ट आता है तो उसका स्वागत करते हैं। वहां कोई अपना स्वागत करने के लिए आते नहीं है, हमको उनका स्वागत करना पड़ता है। तो इसी तरह मतलब इंडिया में एक अच्छा है। और अपने मॉल भी अगर देखते हैं तो अमेरिका के मॉल से जो है वो भी अपना बहुत अच्छा है। इंडिया की इकोनॉमी भी बहुत अच्छी हो रही है। तो आप सब लोगों के सपोर्ट से इंडिया को एक मजबूत भारत अपने को बनाना है। भारत मजबूत बनेगा तो हम मजबूत बनेंगे, हम मजबूत बनेंगे तो भारत को मजबूत बनाएंगे। और उसके लिए हमें कोशिश करने की आवश्यकता है। सेमिनार यहाँ हो रहा है। IHW एक बहुत ही इम्पोर्टेंट संगठन है, इनका नाम कमल है, बीजेपी का सिंबल भी कमल है। और मतलब उनका कोई पॉलिटिक्स से संबंध नहीं है, लेकिन वो हमारे सबके अच्छे मित्र है। और कमल नारायण जी ने एक बहुत ही अच्छा उन्होंने सपना होना चाहिए, पर्यावरण अच्छा होना चाहिए, भारत को मजबूत करना चाहिए, सबका साथ, सबका विकास, सबका प्रयास, सबका विश्वास, इसी तरह की भूमिका हम सब लोगों को आगे बढ़ानी है। दुनिया में जो भी मतलब सभी नेता लोग थे, प्रेसिडेंट और प्राइम मिनिस्टर, इसका जब सर्वे हुआ तो सर्वे में 75% लोगों ने नरेंद्र मोदी जी को पसंद किया। और दुनिया का नंबर 1 का नेता के रूप में उनको मतलब लोगों ने उनके मंत्रिमंडल में मुझे जाने का मौका मिला। जवाहरलाल नेहरू जी के मंत्रिमंडल में थे। उस नरेंद्र मोदी सरकार में मंत्री बनने का मौका मिला है। और मैं सभी लोगों के लिए काम करता हूँ। मेरा मंत्रालय सोशल जस्टिस एंड एम्पावरमेंट है। सबको सोशल जस्टिस के साथ इकोनॉमिकल जस्टिस देना, और बाकी की मदद जो हमारे दिव्यांगजन लोग हैं, हमारे जन है, ट्रांसजेंडर है, अनाथ लोग हैं, शेड्यूल कास्ट के लोग हैं, DNT के लोग हैं, OBC के लोग हैं, ऐसे सभी लोगों को हमारा मंत्रालय मदद करता है। और हमारे मंत्रालय का पॉपुलेशन कम से कम 85% से ज़्यादा आता है। इतने लोग हमारे मंत्रालय के अंतर्गत आते हैं। तो मेरा मंत्रालय जो है, मेरा जी के साथ हमारा मंत्रालय हम ये सोशल जस्टिस का काम भी जो है ये हमारा मंत्रालय करता है। समाज को जोड़ने का जो काम है ये काम भी हम सब लोगों को करना है। और इसी तरह आज यहाँ जो ये सेमिनार हो रहा है IHW ने ये जो प्रोग्राम यहाँ रखा है, इस प्रोग्राम में कमल नारायण जी ने मुझे यहाँ बुलाया है, इसीलिए मैं उनका धन्यवाद करता हूँ। और मुझे आज का दिन हमेशा रहेगा याद, मुझे आज का दिन हमेशा रहेगा याद। मैं करता हूँ कमल नारायण जी का और आप सभी का धन्यवाद। इन्हीं शब्दों के साथ मैं फिर एक बार सभी डेलीगेट जो इधर आए हैं उनको मैं उनका आभार व्यक्त करता हूँ। और कमल नारायण जी का जो मिशन है उसको हमारा हमेशा सपोर्ट रहा है। एवरी टाइम आई एम विथ कमल नारायण। Definitely any problem you come to my mantralaya, definitely I will help all of you. Thank you very much. Jai Bhim, Jai Bharat, Jai Maharashtra.
सर मैं आपसे रिक्वेस्ट कर सकती हूँ कि आप प्लीज 2 मिनट और स्टेज पे रहिए। सर क्या मैं आपसे रिक्वेस्ट कर सकती हूँ कि आप 2 मिनट और स्टेज पे रहिए। May I now request Mr. Kamal Narayan to please come on stage to felicitate our Honorable Minister. Let's have a huge round of applause, please. Thank you so much, sir. It's an honor being here. I would now request Shri Shrikant Bharatiya ji, member of Maharashtra Legislative Council, to please join me on stage to address our audience. Ladies and gentlemen, let's welcome him with a thunderous round of applause. So can I request you to say a few words, please?
इस समिट के इनॉग्रेशन फंक्शन में उपस्थित हमारे महाराष्ट्र के नेता और केंद्रीय मंत्रिमंडल में हमारे मंत्री महोदय आदरणीय रामदास जी, जिनके इमोशनल और लवली प्रेशर के वजह से मैं आज यहाँ पे आया, हमारे मित्र कमल जी, सभी फार्मा मैं शुरुआत में आप सभी का मुंबई में तहे दिल से स्वागत करता हूं। मैं जब यहाँ पे आया तो मैं कमल जी से पूछ रहा था कि आज दिन भर में क्या एक्सरसाइज होने वाला है, और जितना भी मैंने समझा सुना, आई एम ट्रिमेंडस कॉन्फिडेंट कि आज रात को जब ये समिट खत्म हो जाएगी वो ना कि फार्मा सेक्शन के लिए लेकिन देश के हेल्थ सेक्शन के लिए एक नई दिशा होगी और जो भारत को आगे बढ़ाने के लिए बहुत बड़ा रोल प्ले करेगी। 3-4 सेशन से कई डिग्निटीज आ रहे हैं, कई बातों के ऊपर डिस्कशन होगा। हम सभी को ये मालूम है कि भारत से अलग अलग सेक्शन में आगे बढ़ रहा है विश्व के मानस पटल के ऊपर। उसमें हेल्थ मैं जब आदरणीय आठवले जी को मोमेंटो कमल जी दे रहे थे तो मैं वो मोमेंटो की तरफ देख रहा था। यहां जो लोग इकट्ठा है वो फार्मा सेक्शन के लोग हैं, लेकिन जो मोमेंटो दिया गया उसके अंदर जो चिन्ह था वो ना कि कोई हॉस्पिटल का था ना कोई ड्रग्स का था। एक योगा कर रहे ध्यानस्थ व्यक्ति का चिन्ह कि ये सही दिशा है। हमारे यहां कहा गया है कि शरीर माध्यम खलु धर्म साधनम। जिसका आठवले जी ने भी उल्लेख किया कि स्वस्थ तन में स्वस्थ मन रहता है। मुझे अभी भी याद है, जब मैं कॉलेज में पढ़ रहा था तो अमरावती मेरा एक छोटा सा गांव है, वहां पे एक फार्मा और मेडिकोस कॉन्फ्रेंस थी और इट वाज जस्ट 1985-86। तो वहां के छोटे से गांव के भी कॉन्फ्रेंस में मेडिकल सेक्शन डिस्कशन कर रहा था, चिंतन कर रहा था, अच्छा हॉस्पिटल कैसा हो, अच्छा आईसीयू कैसा हो। लेकिन देश जब आगे बढ़ता गया, बदलता गया, तो मेडिकल सेक्शन में, हेल्थ सेक्शन में अब फोकस होने जा रहा है अब ये सोचने लगे हैं कि बंदा हॉस्पिटल तक जाए ना। तो ये जो सोच विकसित हुई है, ये सोच को लेकर आज जो समिट होने जा रहा है, मुझे पूरा विश्वास है कि एक नई पहल, नई दिशा, नई थॉट प्रोसेस ये भारत को आगे बढ़ाने के लिए ये समिट करेगी। मैं कमल जी का और एक विषय को लेकर भी विनम्र आभारी हूं। आपने सबने स्क्रीन के ऊपर देखा होगा कि तर्पण फाउंडेशन को एनजीओ पार्टनर बनाया गया है। मैं बहुत तो समय आपका नहीं लूंगा, लेकिन मैं कमल जी आपका तहे दिल से आभारी हूं कि तर्पण फाउंडेशन एक एनजीओ है जो एकमात्र एनजीओ देश के अंदर ऐसी है कि जो ऑर्फन सब लोग शायद जानते हैं कि जब कभी भी आप आपके व्यक्तिगत जीवन में अकेले में यदि ये शब्द का यूज करते हो, जैसे आठवले साहब ने किया, अनाथ, आपके में छोटे छोटे बच्चे आते होंगे, या अनाथ ये शब्द को यूज किया तो अनाथालय आता है, ऑर्फन जैसे कहते हैं वैसे ऑर्फनेज सामने आता है। लेकिन शायद आप सभी को मालूम है, नहीं है मुझे मालूम नहीं, लेकिन ऑर्फनेज में बच्चा 18 साल तक ही रहता है, उसके बाद उसको बाहर निकाल दिया जाता है। तो 18 साल तक वो इसीलिए ऑर्फनेज में रहता है क्योंकि उसका कोई होता ही नहीं। जब 18 साल के बाद बाहर निकाल दिया जाता है तो क्या उसके सब होते हैं? तो उसे जब 18 साल के बाद बाहर निकाल दिया जाता है, उस मोमेंट से तर्पण फाउंडेशन उनकी चिंता करता है। वी आर द ओनली एनजीओ कंपनी इन द नेशन कि हम ऑर्गेनाइज वे से डेटाबेस विजन सामने रखते हुए ऑर्फन आफ्टर 18 में काम करते हैं। और मैं आदरणीय आठवले साहब को और आप सभी को बड़े विनम्रता से बताता हूं कि हम महाराष्ट्र के अंदर में को अडॉप्ट किया है। बच्चा जब ऑर्फनेज से बाहर निकलता है तो उसका आईक्यू ईक्यू टेस्ट करते हैं, उसका साइकोलॉजिकल काउंसलिंग करते हैं, और वो जो पढ़ना चाहता है, वो जो लड़की पढ़ना है, मैं आपको और विनम्रता से बताना चाहता हूं कि तर्पण फाउंडेशन के कनेक्ट से मेरे 11 बच्चों ने एमपीएससी क्रैक किया है। मेरे 3 बच्चे अभी पीएसआई हो चुके हैं, मेरा एक बच्चा अभी डीएफ हो चुका है। अप टू 18 देयर आर मेनी ऑर्गेनाइजेशंस, देयर आर मेनी इंस्टीट्यूट, इवन यहां तक कि हम हमारे बच्चों को लेकर ऑर्फनेज में लेके जाते हैं उसका बर्थडे मनाने के लिए। लेकिन आफ्टर 18 इट्स ए ट्रेजेडी ऑफ इंडिया सोशल कैनवास कि आफ्टर 18 ऑर्फन में काम करने वाले लोग बहुत कम हैं, नहीं के समान है। कहां तक नहीं है, यू विल शॉक बाय लिसन कि आज तक हिंदुस्तान के सामाजिक जीवन का अभ्यास कर रहे लोगों में से किसी ने भी, लोगों ने ट्रांसजेंडर पर पीएचडी की है, लोगों ने लेस्बियन पे पीएचडी की है, स्ट्रीट बॉयज पे पीएचडी है, ऑर्फनेज पे पीएचडी है, ओल्ड एज पे पीएचडी है, ब्रेकअप पे पीएचडी है। 18 पे ना एक भी रिसर्च है, ना एक भी पीएचडी है, क्योंकि समाज का ऑर्फन आफ्टर 18 सेक्शन किसी ने आइडेंटिफाई नहीं किया। फाउंडेशन महाराष्ट्र में ऑर्फन आफ्टर 18 को लेकर ऑर्गेनाइज बेस से डेटाबेस विजन सामने रखे हुए एक प्रोजेक्ट लेके आया है और मैं बड़े आत्मविश्वास की ये ताकत है कि जब कभी ऐसी नई पहल समाज के सामने आती है तो लोग उसको प्रतिसाद देते हैं, काफी सकारात्मक देते हैं और इसी सकारात्मक प्रतिसाद के तहत मैं कमल जी का बहुत विनम्र आभारी हूं कि उनके टीम ने से भी मैं विनम्र प्रार्थना करता हूं कि हम आज महाराष्ट्र में काम कर रहे हैं और मैंने इस विषय के ऊपर हमारे रिसर्च टीम ने अभ्यास किया। ICSSR करके जो सेंट्रल गवर्नमेंट की एजेंसी है, हमारी रिसर्च टीम जाके मिली, उन्होंने हमें 18 स्टेट का डेटा दिया है कि आने वाले 2 साल में 18 स्टेट में 6,604 लड़के ऑर्फनेज से बाहर निकल रहे हैं और हम अप्रैल से आप सारे लोगों के ताकत के भरोसे हम अप्रैल से हिंदुस्तान के सारे ऑर्फनेज से निकले हुए हर बंदे के पीछे कुछ ना कुछ उनके अंधेरे में एक छोटा सा दिया लेके निकलने वाले आप सब लोगों की साथ की अपेक्षा है। मैं ये मानता हूं कि जिस प्रकार का इनिशिएट आप सब लोगों ने लिया है, हम इस विषय को लेकर ताकत से कदम आगे रखेंगे और मुझे और भी विश्वास है कि आज दिन भर के सारे इस चर्चा के अंदर में हिंदुस्तान के सामाजिक जीवन को और हेल्थ जीवन को एक नई दिशा देने का प्रयास आज दिन भर यहाँ होगा। दिन भर के सारे डिस्कशन के लिए मैं आपको बहुत बहुत बधाई देता हूँ, शुभेच्छा देता हूँ और कमल जी का फिर से विनम्र आभारी हूँ कि आप सब लोगों के साथ में मुझे बुलाया, आपने शांति से सुन लिया। बहुत बहुत धन्यवाद। थैंक यू।
Thank you, sir, for your kind words. Can I request you 2 minutes to remain on stage, please? May I now request Mr. Kamal Narayan to please come on stage to felicitate our esteemed. Ladies and gentlemen, let's have a huge round of applause, please. Thank you so much once again. आपने अपना कीमती वक्त निकालकर यहाँ इस इवेंट की शोभा और भी बढ़ा दी। Thank you so much. Ladies and gentlemen, we shall now have a short 5 minutes break. Request you to join us here in the next 5 minutes so that we can begin our panel discussion. Thank you. gentlemen, we shall now start our first panel discussion, which is based on fixing the fundamentals, moving towards lifestyle for environment, life for good health. And to moderate this session, may I please invite on stage Mr. Kamal Narayan, CEO, Integrated Health and Wellbeing Council. Let's welcome him with a huge round of applause, please. May I now invite our esteemed panelists on stage. Let's welcome them with a huge, huge round of applause. Ms. Shweta Shalini, Advisor to Deputy Chief Minister of Maharashtra and Executive Director, Maharashtra Village Social Transformation Foundation. Ms. Sumaira Abdullali, Environmentalist, Founder, NGO Awas Foundation. Mr. Saurabh Gupta, Founder and CEO, Earth 5R. Mr. Zishan Khan, Environmentalist. And joining us virtually is Dr. R. Vasudevan, Indian scientist popularly known as Plastic Man of India, Professor, Department of Chemistry, Thygarajar College of Engineering, Madurai. Kamal sir, over to you.
Thank you so much. So, good morning again, all of you. So, it's a great, opportunity for me to interact some of the most, accomplished environmentalists and the people who have made the environment as their crusade to environment protection, environment preservation, and how we can, kind of bring together a transformational change for environment and its impact on life. Let me, a few important things as and we have all been here. And the G20, which the country is kind of, up for. Some of the major concerns which we see globally, among them are, apart from what COVID pandemic has brought up, which is, the health emergencies which can, kind of disastrous impact on human life, progress, decades, if not centuries. But at the same time, something more and more profound is it is also somehow not being given that kind of attention, which is environment and climate and its impact on health. In this session, we are talking about the two most major important aspects. As a council, we work on the social determinants of health are very important, and same are the environmental determinants as well. So while we are talking about lifestyle for environment, something where, the 8 billion people of this planet starts living in a manner which nurtures this planet rather than exploits this planet. I think that is what is the core of this whole philosophy. So let me begin with Shweta ji first. Shweta ji, you have seen at multiple level, you have been working on village transformation, area. When it comes to lifestyle for environment, I think the whole concept, and we have seen when we were in villages, and many of you might have been as well. I come from a village in UP. It's a small town, not exactly village, but as good as a village, we have seen life much more closer to the environment. Are we talking about the same kind of life we need to kind of revive back, where we are nurturing our environment, we are nurturing our the surroundings, and not exploiting, which we see in the present globalized, urbanized environment? And what is the cost which we are paying when we are ignoring that environment friendly lifestyle?
ऐसा लगा जैसे आप दोबारा चांस नहीं देने वाले हैं, इसलिए बड़ी सी भूमिका बनाई और फिर बड़ा सा क्वेश्चन पूछा. So there are so many things that you said that for me to answer that question, let me put one by one everything in perspective. First and foremost, let's start from where you started off with COVID. See, let's understand here there are a lot of pharma giants, people from the pharma background sitting out here. I've been coughing for the past 15 days and I've tried it all, right from steroid Omnacortil to cough syrups to Alex Rosarins to, Gharguti Ilaj, everything. Now the challenge is that the environment is throwing at us is changing, and hence our approach to these challenges need to change. What COVID brought us and what is lying right staring at us is 15 million deaths. But you also need to understand, and we understand while sitting on the panel, is that there were 22 million people, children, who could not be vaccinated because the funds were being diverted towards COVID. What we also need to understand is that all the programs across governments, across countries got derailed because somewhere the funds were getting transferred to actually getting the people of the country vaccinated. We lost about 1.5 million health workers to COVID. So let's putting this to perspective, we need to understand and why life came into being. In G20 partnership, when in COP26, Narendra Modi ji went ahead and gave the concept of life, which is lifestyle for environment. What is this? It is Vasudhaiv Kutumbakam. It is Sarve Bhavantu Sukhina, Sarve Santu Niramaya. So when we say Sarve Santu Niramaya, this is exactly what COVID taught us, that we are all connected. If one person does not wear a mask, he is putting the entire room to risk. If one person does not do it, if he is not vaccinated, then the entire country, if there was no lockdown and we were not sitting at home and individually taking care of each one of us, then I think the entire society was at risk. And this is exactly the takeaway that we should have from COVID. And that's when we should realize that because we are all connected, sabka prayas is extremely important. And that is what brings me to your question. Yes, the lifestyle of a village. So what is basically life? Let's understand the concept of lifestyle for environment. See, ultimately, I have 300 saris and there are 365 days. And I can wear a new sari every single day. But do I need it? No, I don't. Somewhere we have fallen in the consumerism world. What is minimalism? Now the world is talking about minimalism. It's very simple. Life, as Narendra Modi ji puts it, is not going towards wants. It is about needs. But this is exactly what Swami Vivekananda ji said. He said that a meaningful life, a purposeful life, is a life which is focused towards meaning and not towards consumerism that the West is trying to throw at us. And this is exactly what we fell prey to. What is online shopping? Today you are flicking, you are watching your reels, automatically they know that this is the kind of interest you have. They throw that kind of advertisement at you, and in a flick of a second, in flick of a button, you have bought it. You might need it, you might not need it. And that's where the difference of need and wants need to be understood. This is exactly what happened in earlier days. My mother used to say कि हमें साल में, मेरे पिताजी तो अच्छे खासे थे, मेरे दादाजी, बट फिर भी साल में 2 ही बार कपड़े मिलते थे. And that's exactly what it is. एक दिन जन्मदिन पर और एक बार दिवाली पर. Now, this is exactly where I think Sabka Prayas counts, and that's what environment is screaming back at us, that each one's effort will count, because this country, this environment is ours. And trust me, I want to add one last bit on this, especially for the pharma companies. I think when we are looking at the challenges of India of the current times, we need to look at our own people. And I want to put this in perspective. uh, most of our deaths, हम यशराज जी को आप जानते हैं, यहाँ बैठे सब लोग जानते हैं, यशराज जी को हर घर जानते हुए भी, यू नो हाउ ही डाइड?
डेंगू।
डेंगी। एक मच्छर की वजह से यशराज जी मर गए। क्या उनके पास कम पैसे थे? And today in California, in Florida, when they had an epidemic where 8 people died because of mosquitoes, they basically went ahead and changed the genomes of mosquitoes so that mosquitoes are not born which can carry malaria. That is the inbound research that we need from companies sitting out here today. That is the thought process that should be driven by platforms like this, because we are still treating our poor of tuberculosis, of the pharma medicines that were made and developed 70 years ago. And for lifestyle problems like IVF, we are having research on a daily basis because वो अमीरों की बीमारी है, वो डेवलप्ड नेशंस की बीमारी है. So please, our challenges are different, and that's where we need to go back, and that is what is Sabka Prayas, and that is what the environment needs from us today. Thank you.
Thank you so much, Shweta ji. You began very, with a very interesting aspect, that you have been covering, and this is something which is a manifestation of our direct connectivity with the environment. All of you know, I come from Delhi, and Delhi, in general, we keep, 400, 500 AQI. Interestingly, I used to come to Mumbai, the AQI apps used to show green all across in Mumbai. But for last 4-5 days, or for last couple of weeks when I visited, it's all beyond 250, 300, even in Mumbai. So what you have been maybe kind of facing is an allergic cough caused by the environment, and that's where the connectivity with the environment is with the human. Ms. Abdulali, sorry, I'm sorry. So when it comes to this direct connection with the environment, you have been focusing on environment, your NGO has been working on this area. How much all of us as a society and as a government also, when we make policies, understand and value this direct connection? And are we working on that side? And what is the cost we are paying when we are ignoring that?
that they will be mitigated, that the money builders are spending and government is spending on thousands of crores of projects money will also be spent on mitigating these effects on all of us, because we are today bearing individually the health burden and costs of these things which I think builders can easily afford to pay rather than us. Thank you.
Thank you so much. A very important point, the aspect, the point of, government advisory, which can, caution the citizens about a certain, aspects of health hazards which are being created. And it has been a practice for many other things. I think Mumbai, because of the coastal city, I'm sure for many cyclone and many other, I was hearing that at the Raj Bhavan, recently they got a device installed by the University of New York, where the Raj Bhavan itself can get a lot of those, kind of cyclone and other, alerts, which they can be prepared, though the government has its own mechanism separately. Similarly, I think it's a very valid point you have raised. Mr. Saurabh, when it comes to these kind of interventions coming from the government, we have seen that in country like ours, it is also about demand and supply. So as a citizen, when we start demanding something, we start looking at the supply of that as well. One of my question, which I want to understand, people of the, how we of getting aware about these important kind of effects of, or the economic burden which we are facing. She also had highlighted about because the health burden is being primarily faced by the people, but at the same time, when we are kind of getting sick because of lack of good air, good water, kind of good food, it is also in reverse putting a burden on the government, because ultimately they will have to come and intervene for cure. It is going to actually increase the burden and also kind of reduce the growth of the country in the from the progression point of view also. So how much we as a society demand for it, and what is the way to kind of make it a people driven movement so that we get these kind of interventions faster than just expecting them?
Okay, thank you so much for the question. So I'll answer this question from more from personal point of view, from experience point of view. So before starting Earth Fiber, I used to work in a corporate. I was working with Cafe Coffee Day, and in a corporate job, I was typical 9 to 5. In fact, not 9 to 5, 9 to those hours would go. you can imagine how corporate life is. So I become very, very obese. I wouldn't. I had like very early on, and doctor was surprised that you shouldn't be having these kind of health problems at this stage. And I had to be hospitalized actually. So at one point of time, there was some sort of a cyclothon happening. I was nominated. There was a prank in the office, and I went to do cycling. I really enjoyed it. I bought a bicycle. I started going to office on bicycle, and in few weeks, I realized I was losing weight, and then there was clarity of mind, better health. I was going off the medicines, and eventually, I finally decided this corporate world is not for me. So I went on cycling. I packed my bicycle on a plane. I went on in Africa. And next 2 years, I was cycling around the world.
You
50.
didn't get the cycle track in India,
No, no, not really. I don't think that we
or not a safe road to cycle.
I cycle on the road and I enjoy that. So 50,000 kilometers I finished because I think that I went over there because there was a lot of NGO projects running in Africa and really wanted to see that how things are done on the ground. So after finishing 50,000 kilometers, I thought that like my health got better, but I was like, now what is more than this? So coming back to Mumbai, I realized that I needed to start fixing my own home. So first, I realized I call this thing as home is equal to planet, which means that our home is a piece of planet, and if our home is not in order, we cannot try to fix the planet. That was the whole point. So started living a more, reducing my needs and minimalistic lifestyle as Shweta was talking. So this is what I've done. It has been a personal journey. My health got better, and from that time till now, I don't need any medicine. I don't have any single, lifestyle issues because I cycle every day. So that has been my personal journey, and what we did was like I went to my neighborhood. I spoke to my buildings like let's segregate the waste. Let's become zero waste. Can we plant trees in our own campus? Should we go for fruit bearing and food bearing plants rather than ornamental plants, because soil is a resource. What is a resource? So we should utilize. So basically, people started joining together, and people reported that they were feeling better, their lifestyle was getting better, the health was getting better. And in the process, the project became very big, and obviously we spread it in 53 countries now. And we have received many global awards, including the French President's award also.
Wow.
So my point is that all this sustainability we talk about starts with ourselves, and we have to really look into ourselves. How are we consuming? What are we consuming? Do we need this much of food? Do we need this much of whatever resources we have? And we have to find out, simple methods of cutting down on our consumption. And personally speaking, I think that I wouldn't blame government because I've seen the same stories everywhere. I was sitting with mayor of Paris, and he was also complaining our citizens are not segregating the waste. And I was like, how have you done it? And he's like, we have sent posters. And I was like, posters are not going to help. People are not interested. You have to build a citizen-centric movement. You have to work hand in hand with the citizens.
Or find them.
Yeah, exactly. So my insight on this thing is that we all share a responsibility. It's a civic responsibility, and this is what we learn in the school. Like civics is a subject, right? So we shouldn't forget that it's our responsibility. We have to be part of change. We have to do it together, and also it's our health. Ultimately, if I have health problem, government is not going to do anything about it. Eventually I'm going to face it. So we have to. My take on this entire thing, as rightly this subject of this conference is that environment is health. It's our health. If we have to be healthy, our environment will be healthy, and I think that it's more about collaborative movement is most effective. That goes a long way.
Thank you so much, Mr. Gupta. Wonderful to hear that your personal journey, and then how you translated into kind of a social movement which impacting so many countries, and kind of winning some of the finest accolades. While you plan to go for cycling in Africa, the one of the important aspect, and that you did it right, because if I want to cycle in Delhi, I don't have any track to cycle, and let's say even if I'm ready to cycle on the main roads, I don't know which truck will, kind of go over me, and I may not be able to reach home back with the cycle. And this has been a
So Kamalji, sorry to interrupt here. There are a whole lot of people who every 1st of January, every year make resolutions that I will go to the gym. And then by the 10th of January, they find out one reason or the other. See, it's very easy to say, he
I
cycles
cycle
on a road,
regularly.
he cycles on a road. We can have 20 different, see, this is exactly what we are discussing. Let's stop blaming the government for everything. I'm responsible for my own health. And the moment I take charge and say that I will cycle wherever because it's for me. I mean, in
I'll come
today's
to
world
that.
where Google tells you everything, you don't need a
So-
government
so-
advisory.
so-
I think I can go back and tell the government 20 different things that, the government should do and is doing. Right? So that's the...
I'll come to that. But yes, what you are highlighting and what Mr. Gupta highlighted.
I would like to
there-
answer that question.
Just a second. The very critical aspect, and that's where we are, focusing on building people-centric movement, people-driven movements, where people are taking charge of their health. But at the same time, when we taking charge of our health, we also need to have the right conducive environment for that, so that our effort flourish at the right direction. Let us take, we have a scientist with us. So while we do, endorse the point of self, kind of action, and I'll come to you, Mr. Khan, later. Let us take some little bit of scientific side of it. Professor Vasudevan, are you there? Is he connected?
Hello? Hello? Hello?
Take our own
Can you hear me?
charge of our health. We will
Hello?
plant more trees. We will plan to, kind of consume reasonably. We will plan to, kind of go for exercise, ensure that our health, we work more towards prevention than, curative aspects. You as an environmentalist,
Hello?
how do you see
Can you hear?
we alone can make that change in terms of ensuring our health, or we also need to have the conducive environment. We also need to work towards, like, for example, we have the National Clean Air Program. Now that program plans to reduce pollution, especially the particulate matter concentration, by 40% in all our cities. You come from Indore, I believe. Bhopal, sorry. So Bhopal is, not in that Delhi, Mumbai, Bangalore kind of, problem, but we have, 131 cities almost, which are under that plan. And I'm sure Bhopal will also be there. Do you see that, when we make policies, and when we want to reduce the pollution, it is very, very welcome policy, very important step forward from the government, and we need it. But when we look into that 40% of reduction, so if you reduce Bhopal, let's say in 100 by 40, it becomes 60. So you get into the WHO kind of, safe zone. But when you reduce 700 in Delhi by 40, where do you land? And will that be a conducive environment for, in general, health to flourish? With deaths. With cancer, around 8,50,000 people die in India every year. In COVID, for 2.5 years, almost the death toll is around 5.5 lakh, because, as per the government, estimates. So the NCD burden which is increasing, it is not only because of the choices we make, but at the same time the environment we live. How do you look at it? And what is your recommendation to kind of balance it out? Can you talk a little bit more about Indore model? How does it happen that we got the cleanest city? How Indore became the cleanest city in the country?
Took their own responsibility of their waste. Hello. So
Wonderful. Yeah. Thank you so much. Good to hear about the Indore. Yeah, we all know about its, the achievements, and I'm sure it is possible only because of a lot of people, participation in the process. Cannot be done alone by the government. So let us, because we are already running late, we'll try to wrap this up with one more round. And more of a kind of recommendations which you feel as we are at a very critical moment of where we are taking leadership in the the accelerating the whole SDG kind of progression. So let me go to Shweta ji. Shweta ji, you highlighted a lot of important aspects. Research we need to increase. We need to kind of make it more people centric. In general, India has called for a very accelerated, inclusive, and resilient. Resilient because
yeah, progress especially poverty, decent work, well-being. Because of the COVID-19. This is something which has been
very logical. When we are taking up the presidency, we have taken, and we are now kind of advocating for a faster progress towards SDGs. How do you see the same being inbuilt in the policies going forward, faster, and also being drilled down to the people level so that we achieve this movement faster?
But thank you for the question. I think it's a perfect question. And when we are talking about sustainable development goals, I think I'll pick up, because I'm sitting in a health summit, I will pick up sustainable development goal number 3, which talks about well-being for one and all in all ages. Now, when we are talking about well-being and health, see, let's understand that SDG does not talk about only health. It also talks about well-being, which you rightly said is about preventive health, which also about post-pandemic health, which also talks about pandemic health. Now, obviously, you're right, SDGs suffered because, as I had said it, that across the globe, 22 million children got deprived of immunization because the funds were transferred. India was one of the countries where vaccines were deliberated upon, they were created, they were built we made vaccines, manufactured vaccines for the first time. We also gave away a lot of vaccines to the HDI low countries. Having said that, coming to SDG 3, now when we are talking about well-being for all ages, now there is 3.1, 3.2, 3.3. Now 3.1 is all about nutrition. So when we are talking about nutrition, we are talking about nutrition of children. We are talking about the first 1,000 days of women and child. Now government has programs. Now, for example, my team of Village Social Transformation Foundation is sitting here. They run this very interesting cup called the Nutri Cup. Now, what is Nutri Cup? Nutri Cup is about nutrition or malnutrition free children in a particular village. Now they are focusing on that. Now government has programs. The problem with that program is government can give you a platform. It can facilitate a lot of things for you, and that's what government should do. They should facilitate. There are also funds available. Now, where are the stakeholders? The most important stakeholders are the government itself, which means the government machinery, which is the system, which are divided into departments, into ministries. Now, yes, there are challenges within that also because it's a large system. Obviously, we sitting on this side of the table definitely want to work on that, because then when we realize that one ministry does not talk to another ministry, one department within the ministry does not talk to another department, we are working on that. Also understand that these are also people, they are also citizens of India, and they need to understand that my stakeholder, not everything is someone else is responsible, I am responsible. So as a bureaucrat, as a small stakeholder also, and when we count on stakeholders, the government, the system of the government is one stakeholder. If you look at it, the NGOs, the community at large, the advocacy, largest community are the citizens for us. And I'm part of this large system. And for anything to make it successful, it is important that I drive it also. I'm equal partnership with the government, with the machinery, with the NGOs, with the advocacy platforms to ensure that I will receive, or I'll be at the receiving end of any SDG goals. Having said that, to answer your question in one crisp manner, I think if you look at the entire list of 17 SDG goals, each one of them is a segment and sector in itself. What we intend to do as a government is focus collaterally on each and every SDG goals. And if you look at the central government and state government schemes that the government comes out with, then they focus on these sectors to ensure these SDG goals are achieved.
Yeah.
As a party that rules the government today, our focus is Antyodaya, which means that when the last leg, when the strata, which is at the lowest level, gets benefited, that's when your topmost level of the GDP gets affected. And that's the reason why I think if the ideology is right, if the thought process is right, if the implementation is right, and if the people at large are with you, I think you will be successful. The best thing in the country that can happen today is that the people today are with the leadership, and hence I'm very, very sure that you will not only see a shift in SDG, but you will see India claiming leadership in most of the SDG goals in G20 presidency itself, because the larger countries, whether it's the US or the EU or China, cannot, because they have always, Mr. Khan just spoke about carbon trading and stuff like that. These are the countries which have put sustainable goals at risk, and that's why we can claim leadership. Today, we focus on Vasudhaiva Kutumbakam, and we shall achieve it.
Thank you so much. Very, I'm sure we all are, kind of in consensus with that. Sumaira ji, for last, especially 8 years, starting from the Prime Minister's, tenure and his call for Swachh Bharat and making it the whole, public-driven movement, we have seen, and that's what Sweta ji also mentioned, that in everything, in important discourse and every aspect of life, uh, people are a big important stakeholder. The important aspect is that have we been looking at people as stakeholders or not? For last a few years, and especially for last 8 years, there has been a whole strong trend where people were looked at as stakeholders. They were involved, they were heard, and kind of inspired to act. Keeping that in mind, how you see that going forward, important social environmental detriments of health, we will be able to, as a country, with the right policy frameworks, with the government support and encouragement, we will be able to move faster. How do you look at this, from kind of non-governmental point?
Well, I completely endorse the point of view that government and people have to work together and that people are the largest stakeholder. I would really hope that this thing will move forward in the way it should move forward, right through policy and implementation. I myself have worked on a very specific sector for more than 20 years now, and that is noise pollution. It is a health issue. Our then health minister, Dr. Harshvardhan, who is also an ENT surgeon and was heading WHO at the time, said in 2021 that India is facing a mountain of hearing loss. A mountain of hearing loss. If you look at the WHO report and maps and charts that they have made, you will find that India has the largest population of hearing loss in the world, and it's an epidemic. I'll compare it in some ways to the coronavirus pandemic, only from this point of view of creating the link between various health issues, of which I'm taking noise pollution only as an illustrative one, but of course it also extends to air pollution and others, that the government, when it came to coronavirus, took very stringent action to protect us. They told us what we should do. They enforced that we did it. And of course, people voluntarily also did it because the doctors were made aware that they have to tell people, educate people. We need similar action with government and with people. I'm very clear that people are very, very important. And again, as illustration, I'll just talk a little bit about my own work, where I have, I mean, through various methods, for various reasons, including advocacy with the government and court orders, the Times of India published my mobile number on their front page in 2003. And I was inundated with calls. And I knew that these calls, I mean, they were continuous. They are still continuous even today. There's not a day that goes by when people don't call me, at least one person, to ask me what I should do about noise pollution. And the answer is complain to the police. Why? Because an NGO cannot substitute the enforcement role and powers of the police or any authority. What the NGOs can do is facilitate the interaction, and it's because so many people have complained that noise has become the second highest environmental crime in the state of Maharashtra. And Maharashtra has become the state with the most environmental crimes in the country. And it's amazing to me today to sit here and say that noise pollution is at such a high level. Why? Because people have complained. So yes, we need both. We need the NGOs maybe as an intermediary, but you cannot say that citizens are more important than government, and you cannot say that government is more important than citizens. We need both. And we need trust between them, and we need implementation of the laws. At the moment, for whatever reason, even today, the noise pollution rules are not being implemented the way they should be. Despite court orders, High Court, Supreme Court, government, people, and something is wrong. And I think unless we figure out what something is wrong and why they are not being implemented, this is just talk in a conference. We need to sit down and figure out how to implement our laws. We have some of the best laws in this world, in the world on environment.
Thank you so much, Sumairaji. Saurabh, I would request you to be a little precise because I think Professor Vasudevan has also joined. we need to, because when we need to also wrap up, a quick, kind of intervention from your side. You have done a lot of, efforts in this space, trying to bring health, something where people act for it. How do you see the next 5 years, especially at a time when we are, kind of reaching to a global leadership, and when, as a country, we are leading, actually, the 1.35 billion people are at that leadership, and they need to show the way to the world. And that's what, Sweta ji also said, that our whole philosophy of, Sarve Sav Bhavantu Sukhina, Sarve Santu Niramaya, how we, exercise that ourselves. How do you see the progression going forward?
So 5 years, yeah, it's not too much of time. It's quite a short time, but we have to do it. So I would say that, to answer very precisely to your question, is there are two ways to do it. One is, obviously there's a lot of shift from the government side also, because you see that when the Prime Minister himself is coming up and taking, like talking about environment and why it is so important, that means that the leadership is definitely concerned about it. So, and also they have formed, for example, international solar alliances, and many initiatives are going on from the government side. So this is going to be, I see it quite a positive step. So I'm hopeful that this will go on, and they're also inviting a lot of organizations and different sectors.
That's the Dr. Vasudevan, can you hear me?
Hello.
Yeah,
Sir, is it audible?
yeah, this is audible now.
Yes.
Dr. Vasudevan. So, Dr. Vasudevan, we have been discussing about how, the life for environment, how we can,
Yes.
kind of contribute at an individual level of protecting environment from you being the scientist in this space. How do you look at, the correlation between the environment and health, and what are the, kind of your recommendations to fix the challenges of health burden which we see because of lack of adequate social and environmental, kind of contributors being managed? I think there is some connection problem. Is there? Was I audible to you?
No, please. The voice is very, very much. I'm not able to make it out. Some sound is coming outside.
Okay, there seems to be some. Anyways, can we wrap it up as of now, because the other panels would be getting late. We'll take some input from Dr. Vasudevan separately, and we'll include in our recommendation.
I'm there from the beginning, but I'm the thing is I'm not hearing anything from this side. I just moved with
Sorry,
this.
Dr. Vasudevan, because it is important to hear you. You need to,
with the time. So